Hey everybody, it's Allison again, www.stlprostretch.com. Please like and subscribe if you haven't already. Today's topic is going to be low back pain. It's a broad topic, I'm not going to lie. And for some people, stretching out the low back is the answer. For some people, for a lot of people, stretching out the hip flexors is very helpful. I would say about 80% of the people that I have with low back pain, barring stenosis or some type of like spinal fracture or some injury, some acute injury they have had with their low back, most of the time with the muscles, it has to do with tightness in the hip flexor. And that would include myself. So I have tightness in my left hip flexor currently. When I run or I'm using my hip flexors a lot, typically the next day I will experience some low back pain. And some people I know it's both sides. Some people it's just one side. What I'd like you to think about is stretching out the front of your body, stretching out the quads, stretching out the hip flexors, while you are maintaining a posterior pelvic tilt, and see what that does for you. For me, a lot of times if I'm running and I just tighten up the hip flexors so much, what happens is I sleep. If I don't stretch it out, I sleep, and then the next day I wake up and my low back on that side is very tight, because it could be both sides, and that causes my low back muscles, my extensors, to spasm a little bit. So I have to do a release on them. A couple ways you can do that. I cheat. I have my husband dig his thumb in between the two vertebrae that are really bothering me, and usually that does the trick. So, but this is called a theracane. And I want to advise you, if anything you're doing in this video hurts, please stop doing it, especially in low back pain. So this theracane has a little knobby part at this end. So if you're really desperate, if I'm really desperate, I will use it, and I'll just sneak it underneath my back in that area where I know that it's going to be tight, and I'll lie on it and sneak it in there. Just put my body weight on it, and then I kind of tilt it. And it might take me a while to find it. Oh, there it is. There it is. And just kind of sit on it and how much I tilt, so I'm pushing the ball up. How much I tilt, it really depends on how much pain I want. I said no pain in this video, but sometimes with the low back, when you're trying to get these muscles to release, there is a bit of discomfort involved, for sure. And I'm right on it right now. So I'm going to just sit on this for like 90 seconds until I can get it to go away. Sometimes I got to go lower. I just get the whole thing, almost all the way down to the sacrum. It depends. And since I just went running the other day, it's pretty tight. So, and then the other option is, barring getting somebody to massage it for you, are the yoga tune-up balls. So you could put those underneath your back. So just do a bridge, lift, put them underneath your back, find that spot. And this works quite nicely as well, because you can kind of roll around on it, and they're kind of soft, so they're pretty nice. So that is another option that you could do to just kind of, you want to release these muscles first, because if they're spasming, and you can stretch them all you want, but most of the time they recommend that you do a release on the muscles first before you stretch them or before you exercise. It's always a good idea. I have another video on releasing the piriformis, the TFL, glute medius minimus. You can also do that with these balls. I'll try to find the video and pop a link on here. If not, I'll leave it in the description part of this video. And now we're going to move on to some stretching. So I'm going to do the hip flexor stretching first. And I want to explain to you why I feel like that's the way to go. You can also do release on your hip flexor, which is, I think, in the video as well that linked. Because you have two hip flexors. Well, you got a little more than two, but two main ones that I want to get into today. And so the psoas, the iliopsoas, it attaches, the psoas major attaches to your spine, your lumbar spine, right? So when it's tight, it's going to pull that lumbar spine forward. And so it's attached in the front of the lumbar, and it goes underneath your organs and then kind of cradles the pelvis and then wraps around the inner trochanter. So in actuality, the psoas, the iliopsoas, when you use it, it does this. Okay, so if I were standing and I were kicking, it would be an external rotation, and I would be kicking out like that. So that is your iliopsoas at work with contracting, shortening, right? So what's happened sometimes is that thing just gets so tight and bound up that it doesn't relax, and it can cause back pain. And I have pulled my psoas on one side, on the same side that I'm talking about. So when that happened, the only way I could get my back pain to go away was to actually manually release it. And there are massage therapists that are out there that do that. I just tug my fingers in there. I don't recommend doing that without supervision, but I could feel them. They felt like guitar strings in there. The other one, the rectus femoris. So the rectus femoris is one of the quad muscles, and it originates at the ASIS, so the anterior superior iliac spine, which is your hip bone right here. It is really the only quad muscle that attaches there, and completely, and can perform hip flexion. But when this muscle performs hip flexion, typically it's more of an internal rotation. So when I'm doing the hip flexor stretch with my clients, a lot of times I will ask them, where are they feeling the stretch? And if they're feeling it inside, that's the psoas. And if they're feeling it more toward the middle to the outside, that's the rectus femoris. So you know which one to stretch, right? They both can pull the hip bone forward and cause the low back to get really tight and spaz out. So I recommend stretching them both. I'm going to go over these stretches with you. And the self-stretch, I have to say, it's not as good as the assisted stretch, because you can't cheat an assisted stretch, and you can with a little bit with the kneeling stretch. But I'm going to bring my right leg forward, my left leg is back. What I want to do is position myself so that I'm in a posterior tilt. This is anterior. That's what most people want to do. This is posterior. So some of you might already be getting a stretch just doing that. So I'm going to take imagine your pelvis is a bowl of water. I want to tilt it backwards. So you might already be getting a stretch there. And if you are, you probably have a tight hip flexor. Either one or the other, either the iliopsoas or the rectus femoris. So I'm going to tilt back, and that's already going to give me this contraction that I need. And it kind of feels like my legs are wanting to scissor together. So I tilt back, and I can feel this knee wanting to pull forward and that foot wanting to pull back. I want you to keep that contraction going. So we don't want to spill forward because you're not going to get the stretch. We want to tilt it back and then come forward enough so that you feel the stretch. If you come forward too far, guess what happens? Start spilling forward. So that is your hip flexor stretch. I'm just moving in and out of it. Even when I pulled my iliopsoas and my muscle, it was kind of spazzing out all the time, this stretch would always feel good on it, even though I'm working the muscle. So just if it feels good after you do it, maybe you need to do it more. Maybe you need to do it a little more relaxed fashion. Maybe you need to come all the way down Maybe we need to come down and let the anterior tilt happen. Take your hands down and then pull the rectus abdominals. So imagine your hip bone pulling up toward your ribs or to your shoulder. Pull it in and sink a little deeper. Okay? So that is one of the stretches. I've only done one leg. Hopefully you're going to survive with one leg and do the other on your own. You will, right? And then the other one is the quad stretch. And this one, I'm going to give you a couple different options. I'm going to do the quad with a foot on a chair. You can do it with a foot up against the wall. I just prefer a chair. It's easier on my foot. So I'm going to kneel on this knee. I'm going to bring the opposite leg forward. I'm going to bring this hand down, flip the foot up, and come right up. I'm going to try to do the opposite of sticking my butt out. So I'm going to give the posterior tilt. So the opposite of sticking your butt out. Imagine the right above your pubic bone pulling up, in and up. That should give you a stretch right there. I'm already getting a stretch. And now I'm going to move forward and back, pushing my foot into the chair and then pulling back. Sometimes this isn't even enough stretch for me. But I'm pushing into the chair the entire time as I'm coming forward and back. And I'm trying to do the opposite of sticking my butt out. So we want to get that posterior pelvic tilt, not an anterior tilt. Anterior tilt would look like this. I get this a lot with this stretch. And when you do this, you're not getting your hip flexor stretched. You're not stretching your rectus femoris. You're not stretching your psoas. You're only stretching your quad by the knee. And it's not really helping you as far as low back pain goes. So that's one way that you can stretch it. Another way that you could stretch it is doing the supine lateral quad stretch. I don't think it's quite as effective for low back because once you get to here, the low back may cramp a little bit. So I don't even know if I'm going to get into this one today. But if you do it the opposite way, if you cross your ankle over the knee and you are pushing the knee out, you can get a really nice low back stretch there. So that's one way that you could go about doing this. Before I get into the twisting, this is another quad stretch. I'm going to loop my strap around. This is for the inflexible people. So I'm going to loop my strap around and lie my belly. I'm going to put the strap around my left foot. And I'm going to lie on my stomach. And then I'm going to bring my right knee. I'm going to bend my right knee. I'm going to bring it out to the side. And then I'm going to pull this strap up over my shoulder until I feel a quad stretch. And if you're doing it this way, you could push and pull, or you could just hold it. Some people can grab their foot. That's a nice one too. And this is that, for me, it's not really a stretch, but for a lot of people, it would be. Probably for the people that need the quad stretching the most. And then we're going to get into some back stretches. Of course, there's cat-cow. I know that. So anything where you are pulling the abdominals in, you're kind of imagine bringing your hip bones up to your shoulders and then rounding the back and then pushing the hips back over the heels. And you could push with your hands once you get here. So that's a good one. You can walk the hands over to one side and back to the other. Typically with these types of stretches, you want to hold for like at least 30 seconds. So each position. For me, I felt that most when I rounded. So I'm contracting my rectus abdominis and pushing the hips back. So right about here is where I'm feeling maximum stretch in my low back. So, hey, if you feel it there, take a blanket, put something back there, and maybe come up on your toes. Round. I think the reason I'm feeling it the most is because I'm contracting my rectus abdominis and pushing back. So that's a stretch for your low back. Another good one is the cow face pose while you're leaning forward. Now, cow face pose, we have a resistance stretch called seated rodeo. And it looks like this. I'm going to take my right knee and cross it in front of the left. And I'm going to sit. I'm going to come up. It's a TFL stretch. As I come up, it's the TFL stretch. As I sit back, it's glute and low back. So try that out. You may want to put something under your knees that's padded. And as you're here, sink back into the hips and bring your arms forward. And bring your chest to your thigh if you can. And hold. So that's another nice low back stretch. Next, we're going to get into squatting and twisting. So, squatting. Heels on the ground. If your heels don't touch when you come to do this one, I would say just take your rolled up towel or rolled up mat, put something underneath your heels. I'm going to toe out just a little bit, and I'm going to bring my hips down, and I'm going to reach forward through my legs as much as I can. Drop my hips. You can twist in this pose. So bring one arm over, twist like that. Bring the arm to the outside. That might give you a really nice stretch. On the other side. As I come to the outside of my knee, I'm almost having to press my elbow into my knee, and my knee is having to push back. But for some of you, that might hurt, and for some of you, it might feel great. It's really hard to tell with the low back because it's just a sensitive area. All right, let's see. Twisting. This is one of my favorites. I'm going to use this chair. It's really heavy, but if you don't have a chair, if you've got something like a weight, like a 30-pound or 40-pound weight lying around, you might not. Or the leg of a table that's really stable, you might want to try this because it's a pretty nice one. So I'm going to lie back, and I'm going to grab hold of, I'm going to move kind of diagonally away from this. I'm going to hold on to this leg of the chair. I'm going to lift my knees. I'm going to bring them into my chest, and I'm going to roll over to the side and almost bring my knees up near my armpit. You could even cross your legs, bring them into the chest, roll over. You don't have to hang on to something. It just adds a little bit to the stretch. Or you could even try, you could try a single leg, but I always feel like the lower back stretch is better with two. So a single leg would look like this. You can also just draw your knees into your chest. That's another great lower back stretch. But here's a good test while you're here. If you extend one leg and you draw the opposite knee into the chest, if you're feeling tension here, I would stretch this first. Versus your low back. We've also got a seated twist. So I'm going to sit like this. I'm going to grab hold of my knee and twist. Kind of come straight, lift my chest up as much as I can as I'm twisting. You cross the knee over and twist. So this is my area of tension, depending on which side you are, or maybe it's both. When I come into this seated twist and I'm wrapped around, I feel a lot of tension in here, which is telling me, okay, I need to stretch this out and then maybe come back to this because I'm uncomfortable. So just notice those things. Notice any other areas of tightness that you may have while you're doing these low back stretches. Something feel off to you. That's really about all I have to say about low back stretches, although the hamstrings could be part of it. So yes, stretching your hamstrings could be very, very important. And also, here's a really good way to know if it's really your hamstrings is take some blocks, get them out here, roll up a mat, or a blanket. Obviously I'm using a blanket, and I'm going to put the balls of my feet on this blanket. I'm going to lift my chest. I'm going to stick my butt out and hinge at the hips. So I'm sticking my butt out as much as I can. And I'm going to reach for the blocks. Now, if I feel this behind my knees, that's your calf. That is your gastrocnemius, most likely. So your low back pain could be coming from your calves. And I have seen that before many, many times. So doing that, and I would hold that for a long time. You could even do lift and lower. And, once your calf muscles start to release a little bit, you can come down farther. You can come down farther. You can come down farther. So I think a lot of people think they have tight hamstrings, and they think they can't touch their toes because they have tight hamstrings. But in actuality, it's their calves that are tight. So that's another thing to think about. But I have a lot of videos on hamstring stretching as well and hip stretching as well, and that might help you out as well. I think with low back pain, and it's just something that I've discovered myself, is if you find something that gives you temporary relief, you might just need to do it more. That's usually the case with just about everything. But I would say don't discount the fact that the hip flexors might be causing the problem. I have pulled both hip flexors, and they've caused me severe back pain until I resolve the issue. So I don't know. I feel like this video wasn't really that helpful, but you could tell me if it is or not. Just leave some comments or questions or whatever you have. And again, don't forget to like and subscribe to the video, and I will see you next time. Happy stretching. Bye-bye.